at the same time, there's a lot of blessings happening. And, one of the things that, we started this 4 weeks ago on April 2nd, these virtual town hall. And, as you know, we've had special guests and whatnot. And today we got an email, and I like to just share this email because this just shares that, what we're doing is making a difference. And one of the things I love for you to do, please, type your questions in the chat box. This is interactive. We definitely our special guest. She's here to share information, and also if you have some specific questions, Tony Jackson and I and she will be here to share what we can. Okay, because again, we're in this together. We're in this together. And so here's the email that just came in, and I want to share it with you. I want to read it with you because I think it really shows the power that we have. The power of one. Right? Each one teach one, each one reach one. And so this came in, it says, Dear Reverend Tony, talking about Tony Jackson, thanks to you and your team for amassing yourselves with current information to keep us updated and informed with the facts that are rapidly affecting our day-to-day life. I have been following the weekly series and learning much. Thanks for the reminders. And I'm sending a shout out of gratitude to all of you great minds for giving of your time, talent, and gifts for the well-being of so many clients. God bless each of you. Gratefully yours, Alice. And so I want to say thank you, Alice, and thank you, viewers. Again, we just said to ourselves, we want to be part of the positive change. And I understand, like I said, COVID-19 has definitely, turned life upside down for all of us. But it's not about what happens to you. What's most important about is how do you respond? And so we are taking this as an opportunity to educate, to inspire, to inform, to empower. And so one of the things I want to do is I just want to share something with you. Can everybody see this? Okay. And this is something that it basically says, and I believe one of three things will happen to all of us. And, I'm not trying to be gloom and doom, but I just wanted to start it off by just saying one of three things are going to happen to all of us, right? And if you can see, it says die too soon, become ill, live too long. And what I'm talking about there is, and that's what we're going to be talking about with this COVID-19, the health implications. I also understand that it's one of those things when you really think about it, it really comes down to this. We have to make sure we take care of ourselves. Spiritually, physically, mentally, emotionally. And so, I want to just say, please make sure that you're doing what you need to do. Drink a lot of water, get some exercise in, right? Take some time out for your mental well-being. If that means for you to meditate, if that means for you to journal, if that means for you to listen to some, positive music, inspirational music, make sure every day you do something for you. I wanted to share that because again, one of three things are going to happen to each one of us, right? Either we're going to die too early, right? And my heart goes out to all the families. One of my fraternity brothers just passed away, just a couple of days ago, and so this is real. One of the things, live too long. What are we talking about there? Right now with COVID-19 affecting the stock market, a lot of people's, retirement accounts have decreased. And so, the number one fear for most retirees is outliving their money. And then number three is get sick. And so we'll be talking about that today. Okay. But one of three things are going to happen to all of us. And we just want to be prepared. So with that being shared, I'm very excited to introduce my colleague, Tony Jackson. And I'd like for you to really, get your notepad. I have my notepad right here because again, we have a special guest. And I would love for you to take notes. And again, please, let's make this interactive. This is your opportunity to ask questions of our very special guest. We're very honored to have her on. And I want you to understand what you get out of life is what you put into life. So let's make the most of this 50-minute session where we can really talk and we can really interact. So you can type in your questions. If you have something that, something that is an amen, you go ahead and type that in. Something that resonates with you. But again, we can see your live chat posts and comments. So we love for you to do that. So without further ado, I'd like to bring up my colleague, Tony Jackson, who's just phenomenal. And Tony, how are you doing?
Hey, Marlon, how are you?
Doing wonderful, man. Glad you're here, buddy. And
Oh man, I'm so excited about tonight. I'm just really pumped about our special guest to have someone of her caliber on our show tonight, and really separating fact from fiction.
yeah,
And it's going to be really awesome. It's going to be really awesome. And again, I think that letter says it all. So, and like, we've talked about that, the real money coach, we want to bring information that is relevant, educational, actionable, and life-changing. And I think we're going to really hit the mark on all four of those tonight. And so really excited.
awesome, man. Well, look, I'm gonna let you go ahead and do your part, and then introduce our special guests, and then I'll come on at the end. But for Yvonne and Evelyn who are here, we say welcome. Yvonne, you may want to, I see you have some technical difficulties. You can see you, but you can't, but it's frozen. Maybe go ahead and just reboot your machine. Technology is great when it works.
Right. And everyone's using the technology now. Everybody's using that bandwidth, right? So
that's right. So,
everybody's working from home, school from home, all that good stuff. So
exactly. And for those of you viewing, go ahead and just type, where you viewing from, and again, this is your time. So if there's any questions that you have, please write those in the comments. So Tony, I turn it over to you.
Thank you, Marlon. Awesome. So Marlon, and our guests and everyone who's watching, I've gotten a couple questions in terms of, what exactly do we do? And I just mentioned, being real, being relevant, educational, and also actionable, which means you can put things into action. We want to bring things that you can actually put into action, and then of course life-changing. Now on the other side of that, from a real practical standpoint, really what we have done these last 4 weeks is really 4 pillars, and those 4 pillars really are at the essence of what we do. I call them the cornerstone of what we do outside of this educational platform. The Real Money Coach is designed to be an educational platform, but what do we do outside of that is really can be summed up into protection. We're protection experts. What we do is, and if we go back to April 2nd, the very first one, we're talking about stock market protection. We had Michael Hardin was a guest on with us, and we are talking about how to protect yourself from the stock market, how to protect yourselves from these declines that we are finding ourselves living in. And we've been through it before. So no, don't fret. We've been through it before. But, if we don't learn from our history, we'll be bound to repeat it. And so we are in the protection business, showing you how to use some strategies that allow you to get the upside potential of the market without the downside risk. And then last week we were talking, and we had the expert with us, Mary Nicole Douglas from MND Accounting. And we were talking about income tax, and we were talking about the stimulus, and we were talking about protecting yourselves from income tax. And I often say when I meet with people, if we lost 40% due to the stock market, and then we turned around and we lost 40% because of taxes, I mean, that's 80%, And so what we find a lot of times when we meet with people is that they don't have a savings problem, they have a tax problem. And so what we want to do is help people strategize to pay the lowest legal tax possible, whether that's in retirement or pre-retirement and that type of thing. And then it kind of fills over a little bit into what we're going to talk about tonight, and that's living benefits. And when I said living benefits protection, what we're really talking about is we're talking about protecting yourselves from those major expenses that can really derail us financially. And we know that there is 67% of bankruptcies were due to some type of medical crisis, 49% of foreclosures. Many of those things were, as we're saying here in the statistics show, they were after some type of major medical crisis. And it wasn't that the people didn't have insurance, they had insurance. But even if my insurance, my health insurance pays the hospital bill, pays for the doctor, minus co-pays and deductibles and all those type of things, my house note is still due, my car note is still due, the kids' tuition is still due. And so life still goes on. And so how do we protect ourselves from that? And if we haven't realized how vulnerable we really are as humans, right? We know that right now because of COVID-19, and we're going to find out a lot about those things. We're going to find out a lot of facts versus fiction tonight. But, those type of things can happen, and it can derail us financially, from a medical standpoint, if I can't work and those types of things, especially if you're an entrepreneur or maybe an independent contractor and there's no sick pay. There's no sick pay. There's no, you're on your own. So that protection is very important. And when we think about it, and we think about the communities, minority communities, African-American communities, Hispanic communities, and even communities that maybe have challenges economically, is just having those coverages in place, having things in place so that those things don't derail us. And even if you have those things, middle class or whatever you may be, it's still an idea and great to have that protection. And then the last cornerstone of what we do is life insurance. And the thing about the life insurance that is so vitally important is, according to the life insurance research, 50% of adults have no or little life insurance outside of their current employer. And with unemployment, last time I looked, and I haven't seen it a couple of days, but over 22 million people have filed for unemployment. And many of these benefits and things that we have through our jobs, when we lose the job, we lose the benefits. And so we know that it's important. And not to mention the number of deaths that we're seeing, due to this COVID-19. And so when Ms. Gibbie Harris joins us, she's going to share some information with us about that. But it's a very, very important, it's a basic need in our financial footprint. And what I like about it is we don't just come of it from the insurance like our parents had. You buy, the agent comes by the house, collects the money, and all those types of things. We also look at it as a tool that can be used for wealth building. And not only wealth building, but how to transfer that wealth to the next generation. And certainly we know that that is a place where we can go and get resources if we've properly done those things. So can you imagine, you lose your job, but then you got a year's worth or 2 years worth of salary sitting inside of something like a life insurance policy that you can go to, and you don't have to wait for the stimulus check to come from the government, but you can take care of yourself and your family. So those are really the four cornerstones to what we do with a lot of our people. Now, the other thing, of course, is financial literacy. As you know, we're very big in financial literacy, very involved in the WINS movement with Dr. George Fraser. And really, we're going to have him on the show here before too long. And just getting financial literacy out into the community. And our primary vehicle for doing that has been the church. And so we've been, and I want to give a shout out to the Park Church. I know many of those members at the Park Church have been a part of these town hall meetings. We had a wonderful class going there with over 130 people. And we teach everything from the psychology of money to budgeting, to credit, to loans, how to get out of debt, what's your current retirement situation, insurance and risk, and then also investments like real estate, stocks, bonds, those type of things, and then ultimately even entrepreneurship. And so we're very, very passionate about financial education, whether it's through the church or whether it's at a business or maybe it's at a school. And so we're very serious about that. And we're very proud of our track record in terms of teaching financial literacy. And so we're excited about all those things, and it all plays a part. And when we think about tonight and the fact that we're going to talk about COVID-19, and some people may be saying, well, your show is The Real Money Coach, and you're having a health issue. But again, it is a relevant issue. And if you haven't noticed, the economic impact has been tremendous on not just our community in terms of Charlotte and the Mecklenburg County, but across North Carolina, across the southeast of the United States, and really from coast to coast, and even from ocean to ocean. It has affected the world. And we have to understand that economics plays a part in everything that we do. But our health is very important. And that's why we wanted to bring in someone who is the leading public health figure in Charlotte, Mecklenburg County, because we want to hear straight from the top. And we want to get our questions answered. And we're really excited about doing that. And so what we're going to do right now is we're going to take about a 30-second break. And then when we come back, I'm going to introduce our special guest, the director of Mecklenburg County Health Department, Miss Gibbie Harris. Marlon, here we go. Are you ready?
I'm ready. I'm ready. I'm ready. I've been born ready, bro.
Are you ready? Are you sure you're ready?
Yes, I am.
All right, man. I'm very excited, Marlon, and everyone, to have our special guest on. Her name is Gibbie Harris, and she was named the director of Mecklenburg County Health Department in October 2017, and as serving as interim health director for 3.5 months. And Miss Harris is responsible for managing the department. There's over 800 public health professionals and a budget of $72 million. The work encompasses clinical services, preventive health, case management, health partnerships, and population health. And I was looking at her resume, and she's did 6 years in Wake County. I think we heard earlier, she's originally from Statesville, North Carolina, right up the road. Go Statesville. And then I see here, in addition, she was also a founding executive director of hospice program in Caldwell County, North Carolina. She has completed several different designations. And I'll just read a few. Some of these, I don't even know what they mean. RWJF Center for Creative Leadership Program, Community Centered Leadership Program in 2014. She's a scholar, and we're hearing all about the CDC. She was a scholar in the CDC's 2008 National Public Health Leadership Institute.
Wow.
Graduated from UNC Charlotte Chapel Hill, sorry, Duke fans, School of Nursing, with a bachelor's degree in nursing and nurse practitioner certificate from UNC Gillings School of Global Public Health, with a master's degree of science in public health and concentration in public health policy and administration. This bio is long and extensive. I think that you can look her up even on Wikipedia, right? She's probably on there, right? So she is, by all means, an expert in public health, and we are very, very pleased that she's joining us tonight. I've seen her on all kinds of news releases and press conferences, and now she is joining us on The Real Money Coach. Gibbie, welcome.
Thank you for having me here. I really appreciate being here tonight.
Yeah, well, we're really excited to have you because we know this. We know that there's a lot of different rumors out there, and and I was thinking about it. I mean, way back, my wife and I were talking about this earlier. That there was a rumor that said that African Americans can't get COVID-19, and that was going around. That was a rumor on social media and all that kind of stuff. And we know that's just not true. And so we are really excited tonight just to hear from you. And I'm just going to turn it over to you. I know that you have some statistics, some PowerPoint, some different slides that you want to go through. So we're just going to turn it over to you for the next 20 minutes, and then we're going to come back and maybe take some questions from our audience.
Great. Thank you. Again, I appreciate the opportunity to talk with the group tonight. This is an issue in our community right now, and I think everybody is aware of that, but I do appreciate the opportunity to give you some more specific information about this. I do have a slideshow. I don't know if, there we go. Okay, so just a few initial thoughts about COVID-19. Number one, this is a novel virus. There are coronaviruses that have been around for years. Unfortunately, this is one that has, our viruses tend to mutate. And when they do, they take on a life of their own. And this one has definitely done that nationally and internationally. So what I want you to know about this virus is that it is very contagious. No one in the world has had immunity to this virus. And that's why we're seeing it go through our communities and a number of people becoming ill, because none of us have immunity to this virus. And we don't have a vaccine at this point. So that's one of the reasons you've seen us talk about social distancing and isolating yourself if you're ill and those sorts of things. And we'll get into that a little bit more. But just be aware that we are susceptible to this, every last one of us. So next slide, please. So this is where we find ourselves in Mecklenburg County today. We have had 1,377 laboratory confirmed cases. What that means for us is that we have had more than twice as many cases in Mecklenburg County as any other county in the state. We've tested over 2,000 people. We have 9 known outbreaks in long-term care facilities, and we've had a total of 37 deaths attributed to COVID-19 that we are aware of in this community. The other point that I want to make, though, is that this 1,377 individuals that have had confirmed cases is the tip of the iceberg. We know now that a number of people will have the infection, but be asymptomatic. They never show symptoms. We've got a number of other people who have minor symptoms, think that maybe they just had a mild flu or a cold or allergies, but they've actually had COVID-19. So we know that there are a number of people in our community who have been positive, and we just don't even have that data because we've not been able to test sufficiently to really know what's going on in the community. So next slide. So this just gives you an idea of what has happened here in Mecklenburg County. You will see the green line down the middle of that slide. What that shows you is when our stay-at-home order went into place. And I would imagine most of you remember that day because it really slowed down our community significantly. The red dotted line shows us expected to see with no intervention. And you can see the number of cases going straight through the roof. The blue line shows you the cases that we had. So you can see that we were on a trajectory to go way up in our number of cases, and that the stay-at-home order has really had a significant in the number of people who have been infected to date, which is what we wanted. The point I will make, though, and you've heard us talking about lowering the curve and extending out over time, by the stay-at-home order, what we've been able to do is slow the number of cases. We are not saying that we will not have the same number of cases over time. It's just that they will take longer for those to occur in our community. And the reason we wanted that to happen is because our hospitals could easily have been overwhelmed by the number of people who were sick and ill and needed to be cared for. But by pushing that curve out and reducing the number of people at any given time who were infected, it's given our hospitals a better chance to adapt to this situation. Next slide. This is a map of Mecklenburg County. You all recognize that, and it's a map by zip codes. And what you can see is that the number of cases in each zip code, the darker zip codes are the ones with the higher numbers, and the codes are the ones with the fewer numbers. But what this shows you is that we have COVID-19 throughout our community. We have community spread. And given time, if you're out in the community, you could be spreading the virus if you're infectious, or you could be exposed to somebody who's infectious. And that's just another reason for us to try to limit exposure in our community at this point. Next slide. I did want to point out, and you've probably heard this in the news as well, is we have seen African Americans in our community and across the country being disproportionately affected by COVID-19. The far left, it's on my left, it might be on your right, the county population of African Americans in Mecklenburg County is 31%. COVID-19, 49% of our cases have been in African Americans. And as you can see, 52% of our deaths have been in African Americans as well. Next slide. Our slides, I got my slides mixed up a little bit, but I'm going to go ahead and deal with this one, and then I'll come back to talk about that last slide a little bit more. One of the things that we've done, because we've seen African Americans being more affected by COVID-19, is worked with our two hospital systems who are doing most of the testing in our community. And they are currently, they've added sites in our African American communities as well as our Latino communities, because we're starting to see more numbers in their cases as well. Atrium has mobile sites, so they change every week. These are the sites for this week. They've been at Clinton Chapel AME Zion Church. Today they were at Forest Hill Church, and then Friday they will be at Northside Baptist Church. Novant has 3 sites that are static sites. They stay there, and they are Monday through Friday, 8 to 5. So one of those is at Beatty's Ford Road. It's in the back parking lot of the Mecklenburg County Public Health Office on that road. The second one is on Executive Center Drive on the corner of Albemarle Road. And then the third is the Michael Jordan Clinic, which is on Freedom Drive. And those clinics run from 8 to 5, Monday through Friday. So these are places that people can walk up to and be screened. That does not necessarily mean you'll be tested, because at this point we're still limiting the testing because we have limited tests available to us, and it takes personal protective equipment to do the tests. We want to make sure that our hospitals and our first responders have the equipment that they need to protect themselves in the work that they do day in and day out. So again, that's limiting us in the testing that we're doing. We're actively working to try to expand our testing and to make sure that we have the equipment and the supplies we need to do that, because that will help us better protect ourselves as we move forward. Next slide. So I did want to point out why we think COVID-19 is worse for African Americans. I want to make sure that you understand there is absolutely no evidence that there's any genetic differences in African Americans that makes this virus spread more in that community. What we do know, though, is in Mecklenburg County specifically, we have higher rates and earlier onset of underlying chronic health conditions among our African Americans. In fact, African Americans are 3 times more likely to have chronic health conditions than the rest of our community. And those conditions put African Americans more at risk for severe symptoms from COVID-19. We also know that many of our African Americans work in essential jobs. So they're working in our grocery stores, in our supermarkets, in our pharmacies, they're driving our buses, they're picking up our trash, they're out in our community doing the essential services that we need them to do, but that puts them more at risk for exposure. And the last thing I will mention, and this was mentioned earlier about how healthcare can derail us financially. We have long-standing gaps in access to healthcare in our community with our African Americans, as well as other resources. We talk about social determinants a lot, whether that's housing or jobs or education. But the other issue we have is many African Americans do not have health insurance, which makes it harder even to access healthcare. And unfortunately, in North Carolina, we still don't have Medicaid expansion, which is creating ongoing problems there as well. So all of these issues, the American community more at risk for COVID-19, and that's why we're seeing disproportionate numbers in that community. So one of the things we've done is work with our 2 hospital systems to try to expand testing in those communities so people can understand what their status is and understand what they need to do to protect themselves. But the other thing we've done is we've created a toolkit of information, and that starts on our next slide, please. And we are looking for our community to help us spread the word about COVID-19. We want to make sure that everyone is understanding what this infection is, what it does, how you prevent it, how you protect yourselves, who's most vulnerable. All of those sorts of things are important for us to know. We talk about social distancing. That is maintaining 6 feet from others when you're out in public. We have asked people now, if you're out in public, and especially in places where social distancing is difficult to do, that you wear a cloth mask. We do have a stay-at-home order that's still in place that really limits what we ask people to do. So we have essential services. We have a number of businesses that are closed. We understand how difficult that is and the challenges that is creating for our any number of ways. And we're starting to see that exhibited, whether that's in violence or domestic violence or health issues. Our children are at home, they're not in school. There's any number of issues that this is causing, but it's been necessary to try to control disease. Many of you may have heard the governor this afternoon with his plan to open things back up in this community. Our county manager is having a conversation. I'm joining her in a conversation with business partners to start talking about how we can start opening things back up in a way to prevent a spike in disease in our community, but can start making things a little bit better for everyone in our community. So we continue to ask you to think about social distancing, especially if you're at high risk, and those are people over 65, people who have chronic health conditions or immune conditions. We ask them to stay at home. They need to protect themselves because those of us who are out in the community are a danger to them because they're the ones that experience this disease in the worst possible way. Those are the ones who are dying from this disease. Most of our deaths have been people over 60, and especially people with chronic conditions. And then we are continuing to track and monitor our data and hoping that can help us manage this disease better as we move forward. This has been an evolving situation. We are learning about this infection every day. And so that has changed our guidance. That's been difficult for people, but as we learn, we try to do better and help people understand what's going on. The last thing that we ask from all of you, everyone that's out there, is to help us spread the key messages and up-to-date information. If you'll go to the next slide. We have created a toolkit, and what's in the tool right now is specifically focused on our most vulnerable populations, especially our older African Americans. These are the folks that we are seeing or who are having the greatest difficulty with this infection. So next slide. Some of the things that are in our toolkit, there are flyers that can be printed or shared digitally. There's infographics, digital images, and other messages for social media, email, blogs, or websites. Anyone that uses those types of social media can access this information. And there's accurate talking points about COVID-19 topics. so that you can share with others in your community, in your church, at your work, wherever you might have the opportunity to do that. The other thing you will hopefully see over the next, or hear over the next couple of weeks, is we've got some radio ads out, as well as some print ads that are going, and more work on social media. Next slide. Thank you. So this is just an example of some of the things that are in the toolkit. These are some of the flyers that you're going to see. They can be both digital and printed. There's more than this, but these are some that we're showing right now. Next slide. We've also got some key messages for social media. Here's one in particular. What a day it will be when we can show off our Sunday's best. Help us get to that day sooner by staying home, except to get groceries or medicines. Always wash your hands for at least 20 seconds and practice good social distancing by staying at least 6 feet away from people in public. There are a number of messages like that that you can use in any number of ways with your community. Next. This is an example of one of the infographics out there. What should I do to protect my family? If you are ill, you should self-isolate, stay at home and away from others, wear a cloth face cover if you must, be around people and wash your hands, clean and disinfect surfaces daily. So there are a number of these infographics that you can use as well. Next slide. There's tips there for ways to share. You can, this particular event that's happening tonight is a great way to get messaging out, and I appreciate the opportunity to be part of this. We want you to be creative and use your voice. It's always more helpful for people in your to get messages from the people in their community. So that's why we're hoping that people will use this toolkit to help get those out. But it's also important to keep your message short and share it often. Next slide. So some of the next steps, here's a download. This is you can go to our mecnc.gov website to get to the toolkit and access all of these things and more that's on that toolkit. We'll be updating this content regularly as the situation evolves, and we're going to be adding other vulnerable groups and adding some information in Spanish around that as well. But if you have questions or comments about the toolkit or other ways that we can improve the work that we're doing through the health department, please contact us through HealthBuzz at mecklenburgcountync.gov. We'd love to hear from you, get your thoughts and ideas. We can always improve on the work that we're doing, and really would appreciate any support as well as any information that you can provide. Lastly, I want to recognize the work that's happening in this community around this issue. We know that our healthcare providers, our first responders are on the front line. They're working every day to try to take care of our community and make sure that people have what they need. I also want to recognize those folks who are working in our long-term care facilities, our nursing homes. They're also on the front line. They're taking care of people who are COVID positive. They're going home to their families and potentially exposing them, but they're continuing to do that to take care of those vulnerable people in our community. And lastly, I'd like to thank next to lastly, I'd like to thank my staff who is working very hard to make sure that we are working with those individuals who are positive, making sure that they isolate themselves, and working with individuals who may have been exposed, getting information out on a regular basis, as well as working with our homeless population. There are a number of different things that are happening. Our Emergency Operations Center is open on a daily basis and doing lots of work to make sure that people have food, that they have the transportation they need to get to the doctor, that they're having the resources that they need to help them get through this situation. And lastly, our leadership in this community, our county manager, our county commissioners, all of our mayors, and all of our city manager, as well as our city mayors, have all been very engaged and involved. They've been on a telephone call with us daily since this started to help us with policy and making sure that we're doing what we need to do to protect the community. And lastly, we've been very engaged and involved recently with our faith community and asking for their help in getting information out, but they're also working hard to support community members in their congregations. So there's a lot of good things happening in our community, a huge volunteer effort going on that's providing all kinds of support. So I have to give huge kudos to our community as a whole. We've come together in ways to be supportive, but that does not mean there's not always room for improvement. So if you have ideas, suggestions, thoughts about how we can improve, I always appreciate those as well. And thank you for the opportunity to talk to you about this. I'd love to answer questions if you have any.
Gibbie, that was absolutely awesome. That was great information. I took a whole lot of notes. I mean, I was taking notes as you were talking. And so we really, really appreciate that. What we're going to do at this point is we're going to, in a second here, go to another 30-second break. But I want to encourage everyone. And I know that we have a lot of viewers that may be viewing from other cities in North Carolina, other states even. But I want to encourage you, while we're taking this break, type in your questions so that we can ask Ms. Harris about them, so we can get your questions answered. This is your time. We're bringing this for you to get the information straight from the source. And so I just, again, encourage you, while we're taking this break, type your questions in so that we can answer your questions, and we'll be back in 30 seconds on The Real Money Coach. All right, we're back. Having Marlon and Gibbie Harris with us. And so we are going to take this opportunity to address some questions. And I guess I'll kick off the questions, and then Marlon, if you have some questions, and then we'll even get some questions from some of the folks who are watching. But again, remember to type in your questions. You know, one of the things that you brought home, and I was looking at the zip code map, and you shared the statistics that 31% of the population is African American, 49% represents the cases, and 50% the deaths. Do we have any idea in terms of, are most of those in a particular age group, or, you know, is there any trends that would make sense when we look at those particular numbers?
Actually, there are some. What we're seeing is that almost 80% of our cases are in people between the ages of 20 and 59. But when we look at the demographics, what we're seeing is that a larger percentage of the cases in the African American are in the 60 and older age group. And that's the group that's more likely to have severe complications, infection. Americans, because the majority of them are over the age of 60 and have chronic diseases.
You know, thank you very much, Director Harris. And I see we have a question from Yvonne, and she asks, is it possible to have the disease and not have a fever?
I'm not sure. Looks like.
Hello?
Can you hear us?
I can hear you.
Okay, I think we ended up with a little glitch, some technology glitch there. But Marlon had asked this question that came in from Yvonne: is it possible to have the disease and not have a fever?
Yes, it is possible. A fever is one of the symptoms that we typically look for, but especially in the early stages of the infection, it's not unusual for you not to have a fever. And some people will may have a low-grade fever. And again, we are seeing individuals be asymptomatic completely and still test positive. So a fever is one of the things that we look for, but it's not absolutely necessary for this infection.
And as far as the vaccine, I know the whole world community is working together. Do we have any ideas as to how close we are, or has there been any maybe minor successes?
What we're hearing right now is that we can probably expect a vaccine early 2021. Wow. So we've got a ways to go before we get to that. And actually, in the bigger scheme of things, based on what it usually takes to roll out a vaccine, that's pretty quick. There's a whole process that you go through to get a vaccine to the place where we know that it's effective and that it's safe. But I think we are looking at sometime in the spring of 2021 before we have one.
Mm-hmm. And with some of the governors making a decision to slowly open up businesses and whatnot, is there any? How do we? I guess let's just put it out there. Is there a concern that we could see another spike as far as those being tested and so on and so forth? Positive.
We do have to be careful with this, and I appreciate the fact that he's being very deliberate and taking a slow approach to opening things back up. I understand the need to open things back up, but at the same time, what we will do while we're opening things back up is watch the data. And if we start seeing spikes, we may need to slow things down or even back them up a little bit. And that's going to be difficult for people. I understand that. But we'll just have to watch the data and pay close attention to that and adjust what we're doing based on what we're seeing. Again, there are many people in our community who have not been affected by COVID-19 at this point that are still without the antibodies they would need to protect themselves from it. So we expect to see more infections over the next 9 months or more until we actually have a vaccine.
Wow.
One of the questions I have, I live in a home with 3 wonderful educators. My wife's a teacher, my daughter's a teacher, my son works at an elementary school. What about the schools? And, I know there are states, I'm not sure if actually North Carolina, I don't think that we've actually made that call yet to cancel school through the rest of the year or do at-home learning. But when you get all those little people in a classroom, even in when we talk about in the fall and that type of year, is there any concern from a public health standpoint in terms of reopening the schools even when the fall comes back?
Well, we do know that that especially our elementary schools are little petri dishes. These kids don't always wash their hands well. They have their hands on everything. They share all kinds of stuff, and they're in a closed environment with a number of them together. So there's always the chance that we could see a spike when school goes back in the fall. I think the governor's going to make an announcement about schools for the rest of this year tomorrow. So we'll see what happens with this year. But the reality is what we're seeing with this infection, which has been kind of interesting, is that our children are less affected by it, either that or they're just not showing symptoms. And at this point, it doesn't even appear that they're significant. But again, we're still learning about this infection and this virus, and we just don't have all the answers at this point. assume that we're going to, again, as we get back into schools, and even if we get back into work where people are working in close, and we're going to have to watch very closely and see what happens in our communities, and be able to react to that in a way that protects, especially those that are most vulnerable.
We have a question from Alice Martin. She asked, how should we distinguish between seasonal allergies and COVID-19 symptoms?
That's a very good question. And right now, allergies are really a problem in this community. I can attest to that. So number one, it's not common to have COVID-19 without a fever. It's possible, but it's not common. And you rarely have a fever with seasonal allergies. The other thing about this particular virus is that what we see is a dry cough. Usually when you've got allergies, you've got a runny nose, you've got postnasal drip, you've got, those sorts of things go with it. But the COVID virus is a dry cough, and typically you have shortness of breath with it. So the symptoms are just a little bit different. If you have a mild case of COVID-19, it may seem like allergies. And that's one of the challenges I have with understanding everything that's going on in the community, because some people are having very mild cases and just can't tell the difference.
So that brings up a important thing, because we know that there's a lot of asthmatic people in our community. It could be anything from a slight asthma to COPD. And so those, I'm assuming, are among that list of folks who are high risk.
Yes.
Any extra
Absolutely. Anyone that has any kind of respiratory issue is more at risk with this infection, because they just already don't have the lung capacity to deal with an additional virus on top of it. People who have asthma, bronchitis, COPD are more likely to have difficulty with flu or pneumonia, those sorts of things. And the same is true with COVID-19.
Now, you mentioned something earlier when you were talking, and I don't think this is necessarily, it probably creates a complication in this time, but you mentioned Medicare expansion, Medicare expansion. Can you kind of talk a little bit about Medicare expansion? Because we look at what's being collected in terms of our tax dollars, and according to the General Accounting Office, over 15% of our tax dollars go to Medicaid. And so why don't we have the expansion here in North Carolina, and what exactly does that mean?
So it's a good question. Medicaid expansion is something that was made available to states after Obamacare came into being. And states had the option of expanding Medicaid, which means more people in our community would have access to Medicaid. It would become more of an insurance for low-income individuals that normally don't have access to insurance. North Carolina, our General Assembly decided not to expand Medicaid. And there are any number of reasons why that happened. And it has been an ongoing conversation down in Raleigh whether and when we might expand in North Carolina. I know our current governor has been very much in favor of expansion, but so far we've not been able to get that through the General Assembly. If we had Medicaid expansion, we'd have a lot more people who would have some level of insurance coverage than they do now in our community.
Yeah, it sounds like to me that there's a gap between people who may be eligible for Medicaid and those who are actually being insured under, whether it's through employer or through the Obamacare, the Affordable Health Care Act. And so to me, it sounds like there's a gap in there, that Medicaid expansion would help to close.
Absolutely. Absolutely. We have too many people in our community who have no health insurance at all. And we know what happens when you don't have health insurance. Number one, you don't get the preventive care that you need. So you're not going in and getting their regular checkups to make sure that you're healthy. And the second thing is that you're not going to the doctor when you're ill. You have to, because it costs money to go in. And quite often you're ended up in the emergency department, which is not a good place for you to get care on any basis anyway. So it's a cost to our community any way you look at it. Our people aren't as healthy as they need to be, which means they can't be as productive as they need to be. And then when they do access our system, they're accessing it at the point of the most expensive care. So it's not a good system. Our people deserve health care, good health care.
And you know, I know for me, being, you know, doing what I do in terms of financial services and advising and coaching, financial coaching, and that type of thing, I know that a lot of what we're talking about, access to good healthcare, access to good food, access to a lot of these things are really economic issues. And because of it being such a gap in terms of wealth, and as we well know from the Harvard study, with the racial gap being born poor and staying poor, Charlotte being ranked last out of 50 metropolitan areas, I think much of what we're dealing with is really economic issue. And if we don't get the economic issue fixed, if we don't get that part done, then, you know, these things will continue to perpetuate themselves. And I believe that COVID-19 is just, if you guys can remember the very first meeting, I had a dollar that was all broken up, and I talked about how our economy is fragmented. And we are finding when these types of things happen, that exposes that even more in terms of the have and have nots. And, you know, we all should be concerned with it.
I agree completely. I think that, you know, poverty is driving a lot of this. And what COVID-19 has done is shined a light on the disparities we have in our community. And we have to deal with those disparities. We can't deal with health disparities without dealing with the fact that people aren't making a livable wage, that they don't have sufficient housing, that they don't have access to the education they need. There's any number of issues like that that directly impact the health of our community. And it's hard for me to focus just on health without thinking about these other issues because they're so closely tied together.
Absolutely. Absolutely. Well, I know we are at 9 o'clock, and I do want to do this. I want to talk a little bit because this really leads us into where we're going to be next week. Next week, and I'm going to show you, we have, I think Chris will even pull it up, but we have a gentleman that's going to be on our show, and he wrote a book called Closing the Racial Gap. His name is Eugene Mitchell. Many people may have heard of him, but Eugene will be here as our guest next week. And the book is called Closing the Racial Gap, the 7 Rules for Black Prosperity and Legacy. And so really what we want to deal with is we are going to deal with the solution. We know the problem. The problem is that we have an economic gap. We have a wealth gap. We have any measurable statistic you want to look at, there's a gap that exists. And so it's not a matter of is there one? We know that the gap exists, but what are we going to do about it? Because we can sit and we can bellyache and we can say all we want about the problem, but we need to bring a solution. And that's what we want to do. And we feel that the solution, it begins with education. And that's why Marlon and I, as we're hosting the Real Money Coach, are committed to bringing experts in that can share with us the real information. And sometimes it's not necessarily about money. Tonight, you could say, you know, it was about health, but your health is your wealth. and you can have all the money you want, but if your health is not good, you'll never enjoy it. And so that's what we're about. It's about bringing something that can be life-changing. So we're really looking forward to next week. Make sure you tune in and find out about the 7 untold rules for Black prosperity, closing the wealth gap. And, the thing I want to mention too is, we talked a lot about Mecklenburg County, but this is applicable across the country, no matter what community you live in. If you're watching this and you've never been to Charlotte, you need to get to Charlotte, because it is a wonderful, wonderful community. I love it. I love it. And if you come here, you'll fall in love with Charlotte too. But we're like a lot of communities, but we got it going on. Let me just say that we got it. Okay. But we're going to talk about closing this wealth gap, because there's always room for improvement. And I look at Charlotte and I see the tale of two cities. You have people who are doing well, and then you have the people who are not, who are struggling. And what we want to do is we want to help everyone. We want to, what do they say? A rising tide raises all ships. And so with that, Marlon, but let me just say one more time to Gibbie, I reached out to your office, and I believe Miss Sonia Smith, if I could just give her a shout out.
Yeah,
and I'm not the first person I talked to, but they put me in touch with Sonia, and she gave me her cell phone. She was just she was wonderful. Got the information to you. You agreed to be with us tonight. And you know what? I do have to ask one more question, because this question came from my lovely wife of 28 years in July. The question was, what about homeless people? How are we addressing the homeless population? And the other thing that you mentioned, and I think, if nothing else, we need to be in prayer, because the shut-in order, and we know the governor extended it to May 8th, and I'm sure that we will comply with that as a county and so forth and so much. But you mentioned that things like domestic violence has gone up. And we know other ills that sometimes when you're going through a trying time, it magnifies. It's like throwing gas on the fire. So we're concerned about the homeless, and there's a wonderful program that, was in our city that also was affected, rooms in the inn, and those type of programs that were affected. So what about our homeless folks? What can be done? Is there resources for them?
Well, a couple of things that there are a number of things that we've been working with our homeless service providers on. The counties and the city both have been working with them, and as well as with our department in working with the homeless. We actually have several hotels that we have leased completely. One of them is that's sort of a spillover for the shelters. So it allows more social distancing in the shelters. So some families and other homeless individuals are being housed in that hotel. We also have a hotel that is specifically for isolation and quarantine for individuals who are homeless and others who do not have a place to be if they need to be quarantined because they've been exposed, or who need to be isolated because they've tested positive. We're working with homeless service providers to put some porta-johns and hand washing stations out into the community, because with so many things closed, they have fewer places to be able to access those resources. There have been decisions made. We're not closing any tent encampments right now. And we're continuing to work with our shelters to make sure that people are housed appropriately. So there's been some significant effort in working with the homeless population, because we know they are at significant risks as well, and have fewer resources than many in our community.
Thank you. Thanks.
And, Director Gibbie Harris, just want to say thank you. This has been really phenomenal. And as Tony said, we reached out to you and your office, and your willingness to share. We just want to say thank you, because time is our most precious commodity. I just would like to close out with this last question. As far as what, I always believe that there's some good, I mean, there's even blessings in disguise. Okay. And so, I understand, COVID-19, I have a family member who was tested positive and was on a ventilator machine in the hospital. So, it really hits home. My question to you is, what are some of the, I don't know, blessings in disguise, as far as maybe we've learned some lessons, maybe, are there some things that your takeaway and, so we can share with the audience that, there's, I don't know, I don't know if you say good, but there's, some things that we're going to grow through this better. Are there any things you'd like to share?
There are a handful of things. I think one thing that I'm seeing is, I know this is hard for individuals, but what I'm seeing is our community coming together to support our community as a whole. There's a lot of volunteering going on. There's a lot of people donating time, resources, money to help those who are most in need right now. There's been huge support for the people that are providing care for the folks that are sick. There's I think an increased appreciation for our healthcare system, for our public health system. Every day I'm working in the Emergency Operations Center. I see lots of different organizations coming together to work together as one, rather than our individual silos to get things done. And when we work together like that, we can do a whole lot more. Right. And so there's a lot of individual stuff going on. There's a lot of group work going on. And there's also, I think, an increased awareness and understanding of some of the places in our community where the needs are the most. And we're starting to focus on those some. So I'm hoping that as we move through this and get to the other side of it, we'll continue that focus and really do some of the things that we've been talking about needing to happen in our community.
Wonderful. Thank you.
Thank you. Thanks for having me. I really appreciate the opportunity.
Yeah, we appreciate you. And so, that here, want to say thank you. And you see the leadership. As Tony said, Charlotte's a beautiful city and Mecklenburg County, because we have leadership like Director Gibbie Harris. And we just say thank you to you and your team who are working countless hours around the clock. Tony, I'm going to leave it to you to say our last words, man.
Well, man, again, I just want to really just thank everyone who's tuned in. And we know a lot of people will be watching via Facebook Live, by our website, YouTube. We want to remind you to follow us, like our page. We're going to continue to bring you relevant, educational, actionable, and life-changing information. So, and the other thing we want to say is reach out to us because we're here as a resource. You can email us at info@therealmoneycoach.com. info@therealmoneycoach.com. If something was said today, even earlier when I was talking about the 4 cornerstones of what we do, just have a conversation, a free 30-minute conversation. And I'll tell you this, it'll be a pleasant conversation. And if we can direct you to some resources that can help you, we're going to do that. But I just want to encourage everyone, again, contact us at info@therealmoneycoach.com. Thank you, Evelyn, for your comments. Alice Martin, Dr. Bonita Harris, Evelyn Denson, Yvonne Harris, and so forth. We thank everyone for your participation. Again, we thank Director Gibbie Harris for her expertise and being willing to share with our community. And now it's just time to put it to action. I mean, we've heard the statistics. We know what's out there. People, please be safe. Wash your hands. Use your mask. Only go out when it's necessary. And so, because we love you and we want you here and we want you to be wealthy, healthy, and well. And so with that, we wish you all a good night, and we'll see you next week when we'll be talking about closing the racial gap. God bless everyone. Have a wonderful evening. Thank you for joining us. Please stay into the, you have her stay into the green room.